Hello, Dr. Banshi Saboo. I'm so happy to have you today on MedSynapse platform. It's our pleasure to have you with us. So first of all, I would like to know more about your medical background.
So I'm Dr. Banshi Saboo. Currently, I'm practicing in western part of India, which is Ahmedabad, city name, which is near Mumbai, since last 25 years. My organization position is I'm past president of one of our biggest Indian Diabetic Society, RSSDI.
Great.
Currently, I'm secretary for Diabetes India.
Okay.
I'm also chair-elect of Southeast Asia region of International Diabetic Federation.
Okay.
And I am vice president of Diabetes Asia Study Group.
Wow.
So, from India to Asia, I'm involved in multiple organizations in capacity of as a vice president or past president or as a secretary for diabetes.
Wow, great background, doctor.
Thank you.
So today at this conference, we would like to know about your session, more about your session. What topic are you going to discuss?
So first, I'm thanking Hossam for giving me an opportunity, and he also asked me to become the honorary president of his meeting.
Yeah.
And as we designed the scientific program, where we had involved not only Indians and Arabic doctors to talk about the technology, as we run in India a diabetes technology meeting, and I'm also the part of one of the international diabetes technology meeting, ATTD, as a part of scientific committee.
Okay.
He asked me that what can we have, and one topic which today I'm going to talk, the diabetes technology where the world is over. So there is a lot of disparity in diabetes technology. Some of the developed country like Europe and US,
Yes.
they are using diabetes technology for all their patients, and they are getting benefit of like putting patients on continuous glucose monitoring or insulin pump and all those things. The countries like Egypt or India, which are developing countries, we are understanding the importance of diabetes technology. Our clinician, physician started understanding, but because of the cost, because of awareness, because of our insurance policy, because of our government advocacy policy for diabetes, and even we have large number of people with diabetes in Egypt and India, but still the technology is not accessible to them.
That's one point, yes.
Maybe because of cost, and maybe because the doctors are also not trained.
Yes.
So this is one of the initiative, what we are doing in India, or what we are doing in Egypt, or what I am doing in Diabetes Asia or in Southeast Asia, to increase the awareness, to increase the capacity building for diabetes technology. More and more doctors should know that this diabetes technology which is available to them, they can use it, what's the benefit it, and how it can be cost effective. So first, when we think of the cost of a technology, it looks very costly.
Yes.
But see the long-term benefit of it. So treating diabetes is not costly. It is always complication treatment is more costly.
Yes, exactly.
So if I use technology in early course of diabetes management, probably I'll be preventing the complication.
Exactly.
And at the long term, I'll be also reducing the cost.
Yes, exactly.
And this we want to, educate our doctors, and at the same time we also create a advocacy for the national level.
Yeah, exactly.
So the government and the health insurance company should adapt this technology more and more.
Yes.
So at least we can prevent the complication. Rather, I will go now. Before that, even we can think of primarily preventing diabetes itself by using the
hopefully,
technology too.
Yes, that would be
So
great.
that is what we are looking for.
This is great.
And this technology will definitely reduce the burden of diabetes and definitely reduce the burden of diabetes complication.
Yes.
That is what I'm going to talk in the
and that's what we
time,
need here in
15,
Egypt
20 minutes.
These days.
But we are going to create a sort of a group, and creating a advocacy in Asia, because we are the one who are having 2/3 of diabetes in Asia.
Yeah, exactly.
It's not in Europe and America.
Yes.
Even they are the leader as far as anything has come. So now, to make it more effective or cost effective particularly, we should have our own innovative technology.
Yes, this is important. Yes.
And we can have more access for that and less costly.
Yes.
That's what we can.
This is very, very interesting.
Thank you.
Thank you so much, doctor. I'm so happy to have you today on my interview with MedSynapse. Looking forward to have many talks with you more and more.
Yes,
Thank you so much.
Thank you.
And welcome on Egypt.
Thank you.